In this lesson, we're going to take a look into the musculoskeletal system assessment and some diagnostic testing. All right, we're going to start our assessment of the musculoskeletal system with a collection of the subjective data, otherwise known as the interview portion of the assessment or the history taking. The first thing we want to do is find out some background information regarding the patient's complaints. We need to know some information regarding their pain, if they're having any numbness or tingling of their extremities, where this problem is occurring at within their anatomy, any weakness, any deformities, any limitation of their movement, stiffness or crepitation. Crepitation, if you're unfamiliar with what that is, it's abnormal popping or cracking noises that may be made, especially with range of motion. We'd want to ask them if they've noted any changes in the size of their muscles, if there's any discrepancies or lack of symmetry in muscle size, say from one extremity to the other. We're going to move on, and then we need to inquire about their past health history, specifically thinking about things like disease processes that may have an impact on the musculoskeletal system. Those diseases might include things such as tuberculosis, polio, diabetes, any history of neuromuscular disease. Have they ever been diagnosed with gout or rheumatoid arthritis, lupus? We would also want to know about any surgeries that they may have had in relation to their musculoskeletal system. In addition to disease processes, we also need to know about any history of trauma to their musculoskeletal system. If they have had any history of trauma, we need to know how and why it occurred. If something like this had happened before, we need to know if it was maybe due to a isolated injury, or if it was possibly related to, again, back to those disease processes like some of the different types of arthritis or connective tissue diseases. Next, you're going to ask about medications. When it comes to medications, our focus here is going to be looking for those medications that they might be using to treat the musculoskeletal disorder that they're reporting, or possibly any medications they're on with known side effects that can impact the musculoskeletal system. And so examples both ways with the medications that I'm referring to. First of all, we would want to know about their use of NSAIDs, non-steroidal anti-inflammatory drugs. Oftentimes, we're going to find that patients are using these over the counter, sometimes even in excessive doses to treat musculoskeletal disorders. And we need to know that, obviously, with the use of NSAID therapy comes the increased risk for the development of gastrointestinal ulcers. We also would need to look at things like anti-seizure medications, because they have a tendency to cause long-term anti-seizure, anti-convulsant medications can cause problems with bones. Some other medications out there, like corticosteroids, can increase the likelihood for the development of what we call avascular necrosis. We mentioned that actually later on in a different lecture. Corticosteroids are also known to cause problems with a decline in bone and muscle mass. Potassium depleting diuretics is another example of a medication that has a tendency to cause muscle weakness and muscle cramping. So those are just some examples of some different drug classifications that can cause us some musculoskeletal system side effects. So that's why we really need to get a good picture of their medication therapy. We need to ask about any surgeries, particularly, again, any history of musculoskeletal system surgeries or other treatments that they've had in the past. Moving on and looking at other questions that you just need to ask in general, you would want to inquire in regards to the patient's activity or exercise level. Some things that we might want to ask them would be specifically asking about their level of assistance that they might need completing their daily activities, and if that's directly related to this musculoskeletal system disorder. We could ask the patient to describe their usual exercise pattern if they do in fact exercise, and if they experience an increase in their musculoskeletal system symptoms before, during, or after exercising. Again, sticking with this activity and exercise theme, we need to ask them about their range of motion. If they're able to move all of their joints comfortably, we need to know if they have any difficulty performing any of their activities of daily living, such as dressing, preparing their meals, feeding themselves, performing basic hygiene, writing, even using a phone or maintaining their home. All of these things are something that it's an example of an activity that can be impacted by different severe musculoskeletal system abnormalities. So we need to know if they're having any issues there. Let's look at their nutritional status next. So again, we've got some specific questions that we can ask to try to get as much information as possible from our patient. We would want to ask about their daily intake of food and snacks, going back to that ADL problem, if they have any difficulties preparing their food. And here we want to make sure to mention that we specifically ask about their calcium intake and vitamin D supplement intake. Also, do they use any other herbal supplements? If they've had any recent weight gain or weight loss, we would want them to describe that as well. Next on our list prompts us to ask about their elimination pattern. So here, some good questions would be, does your musculoskeletal problem make it difficult for you to reach the toilet in time? This can be known as functional incontinence, where they're unable to physically function to get to the bathroom in a timely manner. Do they need any assistive devices or equipment in order to achieve satisfactory toileting? And have they had any problems with constipation? Oftentimes, constipation problems in relation to musculoskeletal system problems can occur due to the medications that they usually take, most often to treat the pain related to the musculoskeletal disorder. Next on your list looks at their sleep and rest patterns. So we need to find out if they are having any difficulty sleeping because of this problem. If they're waking up frequently during the night in pain, are they having to change positions frequently during the night is also something that we would want to ask about. And then again, we could also come back to the medication question and tie this in with finding out if they're using any type of complementary or alternative therapies to help them sleep at night. The last item on the list here looks at their support systems. So we need to know here, it is important in patients with musculoskeletal system disorders, particularly depending on what kind of treatments are going to be necessary for this problem, to find out what kind of support system they have. Do you live alone? Do you have family, friends, or anyone that can assist you? We need to know, we can also inquire, if this musculoskeletal disorder has caused any issues related to their work or their social relationships. But again, I'm going to come back to that. Depending on the treatment plan for this particular problem, we really need to ensure that there is capable individuals present to assist them if they were to need some additional assistance with their activities of daily living. All right, next we're going to move on to the objective data collection, or the physical examination part of our assessment. We're going to start with inspection. During inspection, we are going to observe the general body build of the patient, their muscle configuration, and we'll also want to make sure to note their symmetry of joints. And then by that, I mean noting any swelling, deformity, or nodules that may be present on any of the joints, and also making sure to notice any difference in extremity length. In regards to palpation, you would want to be sure to palpate any areas that are a cause for concern. Next, in your objective data collection would be motion assessment. In regards to motion assessment, you're going to check both active range of motion and passive range of motion of the patient. And you want to make sure that you compare the range of motion of all of the different joints and that you compare both sides. You also want to be sure that if any pain or resistance is noted during a range of motion assessment, that you stop immediately. As far as measurement goes, that's not necessarily something that you would do on every patient, just when it is warranted. So for limb length, you would want to do measurement assessments of limb length when there are discrepancies noted from one side to the other. And then for circumferential muscle mass measurements, if it's warranted for you to do that step, you want to be sure that you measure the largest area of muscle. And you also want to record those measurements making sure to notate the exact location that they were taken. For example, in your notes, you would document that they were that the measurement was taken 15 centimeters proximal to the patella. Make sure to note if the patient's using any assistive devices there in the room during the assessment or to get into the room for the assessment. You're also going to look at their posture and their gait. During posture and gait assessment, you want to look to make sure that foot placement is accurate and that the patient's walk is smooth, even, and well balanced. Another item to note during a gait assessment is that they have a symmetrical arm swing as they ambulate back and forth. The straight leg raise is an assessment component that may be necessary for some patients in order to gather additional information regarding their complaint. The straight leg raise is considered to be positive if the patient reports pain during the assessment. The patient is going to lie back on a table, and this is something that might be done by nursing staff, but it could also be done by the practitioner that the patient is seeing that day. They're going to lie back on the examination table flat, and they're going to then have their leg out straight, and you're just going to simply ask them to lift that leg. If the patient begins to report pain in their leg and their lower back, anywhere between the 30 to 70 degree angle of hip flexion, that is suggestive of either an L4, L5, or an L5S1 herniated lumbar disc. If the pain occurs at a greater than 70 degree of hip flexion angle, this is more indicative of tightness of the hamstrings or of the hip joint itself. So basically what I'm saying is anywhere a positive straight leg raise between 30 and 70 degrees is going to be more indicative of a lower back problem. A positive straight leg raise at 70 degrees or greater is more indicative of a hip problem. As far as muscle strength testing goes, I'm not going to read through all of these different items. I included them right here on the PowerPoint for you. But what this is looking at is this is how we would grade if it was necessary to do muscle strength testing. This is how we would grade and document the presence of muscle strength in each of the extremities. You'll find that we revisit muscle strength testing when we talk about the neurological assessment later on in the course. But just speaking in general terms, a 0 would be scored for any extremity in which there was no movement present, all the way up to a 5 in which the patient's able to demonstrate active movement against full resistance without any evidence of fatigue. Okay, next we're going to take a look at some different diagnostic studies that can be done in conjunction with a musculoskeletal system assessment in order for a practitioner to gather accurate information regarding the patient's potential problem. So the first thing I want you to notice with this slide is that I broke these. This first slide is just lab tests, and I broke them apart into 3 different sections. So on the left-hand side, you see 6 different laboratory tests that may be done, things that we might look at when we're looking for musculoskeletal system anomalies. And I'm going to go through each one of them. So the alkaline phosphatase, this is an enzyme which is produced by osteoblasts of the bone. And so why we might look at this is because we note that elevated levels of this are found in healing fractures. We can also see elevations of the alkaline phosphatase in bone cancers, even in osteoporosis. The next lab on the list that certainly we would want to be aware of is the patient's calcium level. This is important because we know that the bone is a primary organ for calcium storage, and it also helps to provide bones with their rigid structure. We will find decreased serum calcium levels in patients with renal disease. We may also find this in patients with hypoparathyroidism. We can find, on the other hand, we might find increased levels in patients with hyperparathyroidism and possibly some bone tumors. A normal calcium level is between 8.5 and 10. So it is just important to remember that we do need to check this calcium level, and the most important thing to note here is that abnormalities with the calcium levels can at times be related back to endocrine system disorders. All right, next is phosphorus. Phosphorus is going to be indirectly related to calcium metabolism. So that's why it's included on this list. We may find some decreased levels in patients with osteomalacia. Osteomalacia is a disorder where there is softening of the bones. Usually this is something that occurs in relation to a deficiency of vitamin D or calcium. We might see increased levels of phosphorus in patients with chronic kidney disease or patients with healing fractures. All right, our creatinine kinase, we're going to look at this because the highest concentration of this is actually found in skeletal muscles. And we see elevated CK levels in patients with muscular dystrophy and in patients with traumatic muscular injury. So that's why we're going to want to pay attention to that. Potassium would be increased in patients with muscle trauma. And then uric acid, we're going to look at it because it is an end product of purine metabolism. It is normally excreted in urine, but what we do see that makes it relevant to our musculoskeletal system is that in patients with gout, we will see elevated uric acid levels, and a normal uric acid level is between 3 and 7. And we'll come back later when we talk about disorders, and we're going to talk about gout, and so we'll revisit that assessment of those uric acid levels with those patients. So again, those are just some general laboratory tests that may be looked at. And then if you move over to the right slide, you'll see that I broke these two sections up to try and help you with your studying. So up here at the top first, you see the erythrocyte sedimentation rate, and then you see the C-reactive protein. Those two are grouped together. The reason for this is because both of these are indicators of inflammation. You've probably talked about the ESR or the CRP in other classes, looking for inflammation with other body system disorders. But here we're going to be drawing these labs to look for inflammation particular to our musculoskeletal system disorders. We are likely to see these tests done in conjunction with tests like looking for things like rheumatoid arthritis, possibly osteomyelitis is another musculoskeletal system disorder. We may see those done. Know that these are non-specific indexes of inflammation. So what they're going to do is just give us information that inflammation is present somewhere in the body. So they're going to be a diagnostic clue, but they're not going to give us actual confirmation of where the problem is or exactly what the problem is. The last 4 lab tests that are mentioned here, we've got the rheumatoid factor, an anti-nuclear antibody, an anti-DNA antibody, and then the human leukocyte antigen. These are grouped together because if you kind of take a look over them, what you may recognize is that, well, at least 2 of them have the term antibody in them. These are going to be a group of tests that are going to be done specifically to look for musculoskeletal autoimmune system disorders. And I have sectioned off one specific lecture just to cover the autoimmune system or the autoimmune disorders of the musculoskeletal system. But to briefly mention these now, rheumatoid factor is certainly one that we're going to look at because it will give us information regarding an autoantibody that is present in patients with rheumatoid arthritis. It's not necessarily specific to rheumatoid arthritis because we can see elevated rheumatoid factors present in other connective tissue diseases, but it's definitely one step, again, in that diagnostic workup that we would do if an autoimmune disorder was suspected. The anti-nuclear antibody test, or what we call the ANA, is another laboratory test that looks for the presence of antibodies. These are antibodies that may be known to destroy other body tissue cells. This is an important test because we actually find a positive ANA in 95% of all patients with lupus. So we can also see it present in patients with scleroderma and present in patients with rheumatoid arthritis. Again, we're going to talk about those disorders here later on, and so you'll come back and you'll hear me mention that ANA test is going to be an important part of that diagnostic workup. The anti-DNA antibody, again, another test that we have. This is considered one of the most specific tests to be done for lupus. So again, we'll revisit that one, but just so you have an idea that that's another one of those autoimmune tests that we can do. Again, and then our last one here, that human leukocyte antigen, just one more time here, we're also looking at antigens. We're looking for the presence of antigens that are known to be present in autoimmune disorders, particularly those with the musculoskeletal system. So a combination of these would be done if an autoimmune disorder was suspected. Okay, we have several other diagnostic studies that may be included in a workup for a patient with a musculoskeletal disorder. Obviously, the first one that we'll mention is X-rays. This is certainly the most common diagnostic study that would be used to assess musculoskeletal problems, and it's going to provide us with information about bone deformity, joint congruity, bone density, and even possibly calcification of soft tissue. So this is definitely a diagnostic study that we would expect to see as part of almost any diagnostic workup with a musculoskeletal disorder. CAT scans and MRIs, I'll mention them together. These can be done with or without contrast, giving us a little clearer picture of not just the general formation of bones and general structure, but it can provide us with a more fine picture of any structural abnormalities that might be present. So we get a much more detailed image. Certainly, if we add contrast, we're going to get an even more detailed image of musculoskeletal system structures. MRIs are going to be even better at getting fine images of soft tissue structures. Your discogram is next on your list. The discogram is an X-ray done specifically of the cervical or lumbar intervertebral discs. It's done after a contrast media is injected into the disc, and the purpose of this is to show disc abnormalities. It's going to be used to help diagnose the source or the exact location in patients with lower back pain or chronic back pain. We'll talk about that later on. The arthrogram is a procedure that allows for visualization of soft tissue structures within a joint. So this can be used to look at even tendons, ligaments, muscles, and the joint capsule itself. They're going to take an X-ray of the inside of the joint after a contrast medium has been injected into the joint. Oftentimes, the arthrogram is going to be done on joints such as the shoulder, the knee, the wrist, or the ankle. The myelogram is a test done to look for problems with the spinal cord. They're going to inject a dye into the spinal canal, and the myelogram will give us information that shows us problems that are affecting the spinal cord and the nerves within the spinal canal. It's a very sensitive test that can be done to look for nerve impingement. It can also detect very subtle lesions and injuries of the spinal cord. It may cause a spinal headache, and it's mentioned here because, again, it might be something that's done in conjunction with a workup for lower back pain. We'll come back and even mention the myelogram later on when we get into neurological disorders as well. The electromyogram, or the EMG, is a test that can be done both for the musculoskeletal system, and it's oftentimes done even to detect neurological system disorders as well. So you're going to hear this one both more times than one also. With the EMG, small gauge needles are actually inserted into certain muscles, and an electrical stimulus is delivered through those needles into the muscle with the purpose of causing a contraction. With this test, what we're actually looking for is the patient to have muscle contraction as a result of that electrical stimulus. And if those contractions are present, this can actually be a very uncomfortable test. If you read in your book about the EMG, it'll pretty much tell you that we're to tell patients that the discomfort is oftentimes surrounding the needle insertion. But if you've ever known a patient to have an EMG, or if you've ever had one done yourself, what you'll find out is that patients say that the actual test, the procedure itself, is very painful, especially if they have, if the muscles do properly contract in reaction to the stimulus. Certainly we're looking for muscles that don't contract. That would indicate to us a problem. Some things that we need to, especially with the EMG, something that we need to provide patient teaching on in regards to the EMG is we do not want them to have any kind of stimulants or sedatives. So stimulants such as nicotine or caffeine for at least 24 hours prior to the procedure. So they need to avoid both stimulants and sedatives for 24 hours prior to this test. Moving on through the rest of our diagnostic studies, we're going to mention the bone mineral density studies. You've got the dual energy X-ray absorptiometry test, or what we call the DEXA scan, and then we've also got the quantitative ultrasound. I mentioned them briefly here, and then I'll talk about them a little more when we actually get to our discussion on osteoporosis. So the bone mineral density measurements are going to be done to assess bone density. The DEXA scan is one that is done that provides a minimal amount of radiation exposure. It can look for, obviously, as I mentioned, changes in bone density, and other problems with bone diseases can also be detected with the DEXA scan. One difference with the quantitative ultrasound is that there is no radiation with that test. And this can evaluate, again, the density, the elasticity, and even the strength of the bone. The most common area assessed using a bone mineral density study is the heel. I'm going to come back to these tests when I talk about osteoporosis, and I'm going to give you some more specific information. You don't need to know it right now, but when we get to that point in the lecture, you are going to need to know the findings in relation particularly to the DEXA scan. So just know you'll learn more about that later. A bone scan can also be, it's another test that we can do that can be done involving the injection of a radioisotope to detect different types of bone cancer. Bone scans can be done to detect osteomyelitis, which is going to be an infection in the bone. And we can even use bone scans to detect certain fractures. What we'll see is when this radioactive isotope is injected, the pictures are taken about 2 hours after the injection is given, and the whole test itself, once the scans are being started, it takes about an hour to finish taking all of the scans. So it is a little bit of a lengthy test that they have to go through. What we expect is that the bone would have a uniform uptake of the isotope. However, in cases of osteomyelitis, different bone cancers, and even some fractures, what we'll see is an increased uptake of that isotope in that area. And on the opposite end of that spectrum, in cases of avascular necrosis, and I mentioned that earlier, and I told you we would talk about that in relation to some hip problems, avascular necrosis can occur where there is a lack of blood flow to the area, and in those cases we would see a decreased uptake of that radioisotope. An arthrocentesis is a test that can be both a diagnostic test and a therapeutic procedure. So with the arthrocentesis, we're going to actually insert a needle, or a practitioner is going to insert a needle into the joint cavity to obtain a sample of synovial fluid. That would be the diagnostic approach. They can also do it as a therapeutic approach to actually remove excess fluid from the joint cavity. So arthrocentesis are going to be helpful in diagnosing joint inflammation, infections. It also can be used to help diagnose subtle fractures and meniscal tears. We're just going to teach patients that arthrocentesis can be done right at the bedside or in an examination room. An important nursing implication to keep in mind if you have a patient undergoing an arthrocentesis is, one, they're going to need an informed consent signed for this procedure, and second of all, after the procedure, we're going to need to apply a compression dressing, and we're going to want to observe that compression dressing carefully for any leakage of blood or fluid. The last item that we have here on our diagnostic studies to mention is the arthroscopic surgery. Again, this is another procedure that can be both diagnostic and therapeutic. In this procedure, an arthroscope is going to be inserted directly into the joint cavity to examine the interior of that joint cavity. It's done after anesthesia has been administered, and they're going to do it by first inserting a large bore needle into the joint and distending that joint with either fluid or air, then inserting the scope, taking some pictures, and possibly even biopsying the synovium or cartilage during the procedure. This can be also, as I mentioned, a therapeutic procedure in that if any torn tissue is identified, it can be repaired during the arthroscopic process, which would actually decrease the patient's recovery time. So they can do a little cleanup with this procedure also.